Waste management. The objective for this training is for the health worker to describe waste and explain the consequences of improper healthcare waste management. List the different sources and categories into which healthcare waste are segregated. Explain the principles of healthcare waste management and describe the color codes recommended for segregation of solid waste. Describe the proper ways of transportation, storage, treatment, and disposal of different types of healthcare waste. We want to talk about the background of healthcare waste management in Ghana. Define waste, define healthcare waste, describe source and example of healthcare waste, type of waste, describe general characteristics and quantities of healthcare waste, provide examples of different classification of healthcare waste, discuss the importance of healthcare waste management, discuss the examples of healthcare waste segregation, discuss waste treatment and disposal. Healthcare facilities generate different kinds of waste during patient care and daily operations, which has the potential to contribute to infections among hospital staff, patients, caregivers, and pollution of the environment. The dangers associated with healthcare waste have contributed to global attention it has received from many countries and stakeholders. Making a deliberate effort to manage such waste properly to safeguard human health from various risks associated with such waste and protecting the environment integrity is an important public health imperative. Definition of waste. Waste can be defined in various ways. The following are few of the definition. Waste is the leftover, a discarded product or material or in original value for the owner and which he or she will get rid of. Waste may also be defined as all solid or semi-solid materials that are no longer considered of sufficient value to be retained in a given setting. Waste can also be defined as any garbage, refuse, and other discarded materials, including solid, liquid, semi-liquid, semi-solid, and gaseous materials resulting from industrial, commercial, mining, agriculture, and community activities. Healthcare waste include all solid and liquid waste, both hazardous and non-hazardous, generated related to medical procedures or the performance of medical research involving human and animals. In addition, it includes the same type of waste originated from minor and scattered sources, including that produces in a course of healthcare undertaken in the home. That is home dialysis, self-administration of insulin, and recuperative care. Types of waste. Waste can be categorized into three major groups. These are solid, liquid, and gaseous. Examples of waste: solid waste and liquid waste. Solid waste: domestic waste, rubbish, ashes, house sweeping, and other bulky waste. Estate waste, that is industrial, municipal, agricultural, hospital, demolition and construction activities. Liquid waste: household toilets, public toilets, street drains, storm water, affluent, sewage, and industrial liquid waste. Gaseous waste is a waste produced in a gas form resulting from various human activities such as manufacturing processes, material consumption, or biological processes. Gaseous waste can be anything from the gas expelled in a pulp to the exhaust from a car engine. Source of healthcare waste. Healthcare waste can be broadly classified into 4 types, that is industrial, commercial, domestic, and agricultural. Healthcare waste is a byproduct of healthcare that includes sharps, non-sharp, blood-contaminated items, blood itself, body parts and tissues, chemicals, pharmaceuticals, radioactive materials as an example. Categories of healthcare waste. Healthcare waste can be classified as hazardous waste or waste that are associated with some health risk, and that is about 10 to 25% of all the waste generated in the health facility. The non-hazardous waste or general waste comparable to domestic waste is about 75 to 90% of healthcare waste in the health facility. This means that the non-hazardous waste are in a large number in health facility. Waste segregation. Waste segregation is separating and sorting of waste to facilitate recycling. It is also separation of different classification of healthcare waste from each other, beginning at the point of generation and maintaining the separation during storage and transport until treatment and final disposal. This objective of waste segregation is to reduce the amount of waste that must be treated as hazardous. It's also to reduce the risks for health workers. It's also to lower the cost of treatment and disposal. It is also to make waste recycling possible. And the last one is to reduce the environment impact. That's the reason for waste segregation. Segregation scheme. We have type of waste and the color or container that the waste must be put in. So the red color is highly infectious waste or pathogens or any infections that is highly organism that is very highly infectious, and the color code for the segregation should be red. The other infectious waste, trace chemotherapy waste, should be put in the yellow with biohazard symbol, and it should be put in the leak-proof plastic bag or container. Sharps. Yellow marked sharps with biohazard symbol, and it should be put in puncture-proof container. Brown should be labeled, and chemical or pharmaceutical waste should be put in, and the plastic bag or rigid container. Radioactive waste must be put in the lid box and should be labeled. Black bag should contain general healthcare waste. So the color-coded bin, the black bin, the yellow bin, the brown bin, and then the red bin. The black should contain general waste. The yellow should contain infectious waste. The brown should contain chemical waste. And the red is highly infectious waste. And these are some of the things that should go to the infectious waste, like soil cotton wool, body parts, soil plaster, gloves, face mask, drainage tube, NG tube, infusion bag, giving set, contaminated by blood and sanitary pads. The black bin, items to be put in are papers, leftover food, carrier bags, pen, fruit peels, empty water bottle, sachet water, and paper tissue. And the sharp box, which is puncture-proof, should contain needles and syringes, cannula, scalpel blade, sutures, broken ampoule, etc. Bags for waste containment and collection. Bags should be of the same color as the hard container. The plastic bag and bin should have the biohazard symbol prominently displayed. Cautionary markings on the outside of the bag and polyethylene bags to be used for the waste are to be autoclaved. Storage of waste. Storage is the time lapse between the production of waste and the collection for final disposal. This is classified into internal storage. That is one. It is a temporary placement of waste at the point of generation before transfer to external storage points and should not exceed 24 hours. The following measures should be taken to ensure safe management of waste at the point of generation. That is, storage time should be reduced as much as practicable. Multiple daily removal of the waste is recommended. 2. External storage. External storage refers to the period and transit point where the waste is stored after removal from the internal storage to the time it is collected and transported for treatment and final disposal. Waste collection and transportation. Waste handling requires proper trained staff, use of proper PPEs, use of good body mechanics, proper equipment, carefully designed transportation routes. Ensure the waste from each area is collected when 3/4 full. Ensure that containers are not overfilled. Ensure segregation is maintained. Reapply bags or containers during removal. Janitorial staff should ensure that bins are kept clean. Waste collection and transportation require this type of PPEs. That is your masks, your rubber apron, your boots, and your gloves. That is the long, hard gloves. Example of internal bin. The internal storage bin should be pedal and should be movable. Treatment of waste and disposal. Treatment deals with using some technology, processes, and procedures to render the waste sterile or non-infective. The main purpose of waste treatment and management is to reduce the potential hazard posed by the waste in order to protect the public and the environment. Treatment approaches. On-site treatment, that is the hospital treats its own waste. Cluster treatment, hospital treats its own waste from healthcare facility in a small area. Central treatment, this is dedicated facility, collects and treats waste from many health facilities in the urban center or region. Treatment processes for emergency. Thermal treatment, that is incineration and non-incineration. Chemical one, within chlorine, bleach solution, peracetic acid, lime solution, and ozone gas or dry organic chemical. Mechanical. Mechanical treatment is by shredding or compactment after treatment. Incineration. Incineration plant means any stationary or mobile technical units and equipment dedicated to thermal treatment of waste with or without recovery of the combustion heat generated. This includes incineration by oxidation of waste as well as other thermal treatment process, such as pyrolysis, gasification, and plasma process, insofar as a substance resulting from treatment are subsequently incinerated. Non-incineration or autoclaving. It's capable of treating a wide range of waste, including COVID-19 waste, excluding chemical, cytotoxic, and pathological waste. It also consists of metal vessel designed to withstand high pressure with seal door and an arrangement of pipes and valves through which steams are brought in and removed. A typical autoclave operation conditions of 121 degree for 30 minutes must be tested using biological indicators. Chemical treatment. Eliminate microorganisms or reduce the amount to an acceptable level. Microbial inactivation tests are important to ensure that concentration and exposure time is sufficient. Since many disinfectant solutions lose their ability to destroy pathogens with time and organic load, the strength of the disinfection solution should be monitored. Many chemical disinfectants are themselves hazardous and toxic, so proper precautions should be exercised and PPEs worn for safety. Wastewater discharge should also be monitored. Disposal. Disposal is the process of placing waste in a particular place, usually approved by EPA as the final destination. Highly infectious waste should not be disposed at any place without treatment. Disposal can be done at hazardous waste cell, at an engineered sanitary landfill, controlled dump site. However, if the waste is decontaminated through high-steam autoclave treatment method, it can be disposed at the landfill site. Autoclaved treatment waste may be shredded or compacted before disposal. This means an extra cost. If waste is incinerated, the ash and residues must be properly packaged and disposed at a hazardous waste cell. Where such facilities are made available, they can be immobilized with cement and dumped at the municipal dump site. Burying ash residues in an unlined open pit at health facility premises or elsewhere is not recommended or acceptable. Health facilities generate different kinds of waste during patient care and their daily activities, and this has the potential of infecting hospital staff, clients, and the community as a whole.